Let me welcome all my viewers once again today on Beyond Sugar. As you all are aware, Beyond Sugar is created for all of you in collaboration with RSSDI and Indian Society of Nephrology so that you are able to get exact, accurate, and scientific information related to diabetes and its complications, and you can take care of you. Not only we post information for you on a daily basis related to diabetes, but also we invite for you leading doctors from across the country who can talk to you as a friend and answer your questions as well. So in this series, I am very glad and happy today to welcome Dr. Vijay Lakshmi GS from the city of Chennai. Ma'am, welcome to the show.
Good evening. Thank you for this opportunity to be able to connect to all the diabetic population as well as the caregivers.
Welcome. So, today we will be talking about a very interesting topic on which we keep on getting, quite a few questions and chats, and that's about the psychosocial support which is required for people who are with having diabetes or maybe their caretakers as well. And today we will use the expertise of Dr. Vijay Lakshmi to have a conversation on this. But before I start taking the questions, let me, formally introduce her to you. She's a well-known and leading diabetologist practicing in the city of Chennai at KM Specialty Hospital, KK Nagar. She did her graduation way back in 2001, and post that, she did her post graduation in diabetes and fellowship in 2006. For last 17 years, she is serving her patients. So we know that we are talking to an expert today whom we can fully rely on this subject. Before I move forward, ma'am, let me welcome you, formally here and hand over the stage to you for your opening comments on this topic.
Thank you. I think the topic that we chose today is like very relevant to every diabetic patient, be it type 1, type 2, or gestational diabetic. Because see, when we give them a diagnosis of type 2 diabetes, even though we say it's actually, I keep saying this very often, that type 2 diabetes is not a disease, it's a disorder. So we can actually fix it and you can have a very healthy life. But still, that said, it's still a lifelong sentence for them. It's not something they can get away with, like 1 week of antibiotic therapy or a few months of any treatment course. It's a commitment from them that requires a change that is consistent, and everything right from what they eat to when they eat, and what activities they do before, after. Everything is like kind of has a place in the therapy as well. So they need constant attention to be given, and it's not just the patient alone. I think as a family, the caregivers, everybody is equally involved, and they're all stakeholders. So how it affects their life, like once you diagnose with type 2 diabetes, it affects them, economically as well. It's like something that they have to spend on, not only financially, the time and the planning, everything is involved. So I think this is a very important topic that we're discussing today.
Yeah, and as you rightly mentioned, I'm sure it starts right at the time of diagnosis. So whenever someone comes to you, he's diagnosed for the first time, and you tell him or her that you have diabetes. I'm sure it's the stress begins from there, and someone may feel that I'm going to be carrying this now for rest of my life. And more so, these days a lot of younger population in 30s, 40s, they also are diagnosed, and they may have a sense of deniability as well. They won't agree that, okay, how can I have? So how do you handle such situations, and what kind of counseling and you guide your patients at that time?
See, there was an age where diabetes was considered to be disease of the older population, and also there's also a misconception that rich people used to get diabetes. All that myths have vanished now. The poorest of the poor develop diabetes, and very young, healthy people, whom we consider to be young, are still getting this disorder. Because firstly, it is a lifestyle disorder. We need to understand. Being Indians itself puts us in the high risk radar, because genetically we have this high insulin resistance. We have these typical, what we call fat index. Even though when our BMI, when compared to the Western populations, we look thinner, we have subcutaneous fat in the wrong places. So we have more of central obesity. So as
Hmm.
an individual itself, by genetics we predispose to diabetes, and I'm sure like 90% of our population has a very strong family history of diabetes as well. And what we've noticed, the age of onset is coming down with every generation. Like if your grandfather had the diabetes at 60 plus, your parents would have developed diabetes at 40, 50 plus. And now if you see, the younger population is getting it as 30, 11, 20, 25 years of age. That's the kind of price we pay for our westernized lifestyle. Everything, for everything we have gadgets, and even for the gadgets we have remotes, and that also is like operated through our mobile. So, and the way we eat also nowadays, we don't even go out to eat anything. We just have to order, and all we have all the online portals to give us serve us all the
Hmm.
junk on earth immediately. So I think all this contributes to the age of onset of diabetes coming down. I think
Hmm.
there's a lot
So
of
you yeah.
is my
Sorry.
audio clear?
Your audio, you can be little louder. I think it is
I think there's a lot
little
of
weak.
background disturbance. So when a young person is initially diagnosed with diabetes, first thing is, as you rightly said, there's a lot of denial. First they think like I'm completely okay. I was okay, and you're stamping me with the disease, which I don't think I really have. So we need to sit down and explain to them that it doesn't happen overnight. That we all have to understand that you don't become a diabetic overnight. It's a slowly progressive disorder where the beta cell reserve comes down to less than 50% before the blood sugars actually hit those diagnostic mark of fasting more than 120 and postprandial going beyond 200. So there is a background beta cell loss and insulin resistance that is happening even few years before the onset of diabetes. So we need to
Yeah.
explain that to them, and initially maybe they can try to put away, do away with medicines, and a very good lifestyle modification can help them maintain the blood sugars. But once you are
Yeah.
diagnosed with diabetes, you have to understand that it's going to stay with you. Maybe you can control it with the diet and exercise initially, but don't like just shy away from the fact that you have this and completely ignore it, and like that is the problem. As long as you give it the proper attention and take proper care of your blood sugars, you still are going to be perfectly healthy. But denial is not going to help you.
Yeah. So what we understand is that you spend some good time with the person, right away on the first go, and
But
help them understand about this whole disorder. And I think the psychosocial support starts there itself with the doctor. I think the first counseling which the treating physicians will do. It's since our topic today is around this, so I'm compelled to ask you, a couple of questions around this. And we talked a lot about that. There has to be good emotional well-being, especially once you are diagnosed with a disorder which is going to stay with you and it may lead to stress. Now, is there any scientific correlation within the body that can between emotional well-being or stress with the blood glucose levels? Does it affect the blood glucose levels also if the stress is high?
absolutely. See, stress hormones are what we call counter-regulatory hormones. Okay, so normally a stress hormone typically goes up when you're under very acute stress. How how you can understand is if there is maybe a fire in the room, or if a wild animal jumps up at you. What do you need? Your body immediately needs a big rush of glucose so that you can run away from there. Either you have to, it's called fight or flight hormones. You either fight that situation, or you try to escape that situation in a very stressful condition. This is what, in acute stress, this is what our body needs, a big boost of energy so that it can deal with that situation. But when the same acute stress becomes a chronic stress in our body, the body doesn't really understand that this is a chronic stressful situation, and you need to turn down the stress hormones. When you are stressed for a prolonged period of time, the body still keeps your stress hormones at a higher level. So all these stress hormones that we're talking about are counter-regulatory hormones that work against insulin. So therefore, the body doesn't actually effectively utilize the glucose properly, and there's a lot of insulin resistance because of all the counter-regulatory hormones that go up. So chronic stress, especially sleep deprivation, all this can lead to the sugars going up.
Okay. All right. So there's a clear cut, correlation, as Dr. Vijay Lakshmi helps understand that if you are having a good emotional well-being, low levels of stress, then it may help manage your diabetes or blood sugars levels as well. Also, please help us understand, ma'am, that how can an individual self-assess, like, what's his stress levels? Is it appropriate? As you said, it's normal and natural to have it. So, how do someone self-assess that this is an appropriate level of stress or more than what is required? And what should he do, let's say, to seek support, or when should he decide to seek any help on this?
See, stress is something I think even children use nowadays, like even small kids know the meaning of stress and they start using it. But everybody, I think, everybody has their own level of challenges in our life. As long as it's just challenging and we're able to face it and overcome this challenging situation, it is part of life. If there is no ups and downs and no challenging, life cannot be flat without any surprises and challenges it throws at us. But when it becomes overwhelming, when you're not able to handle it by yourself, either you're not your appetite goes down, or especially when your sleep cycle is altered, that's like an alarm clock. If you're not able to go to bed and not think about whether whatever is stressing you out, whether it be work or relationship issues or financial burden, anything that's bothering you, if you're not able to shut off the problem and sleep for 6 to 7 hours, then that's definitely an alarm clock that your stress is overwhelming and you need to get assistance. Again, like in our country especially, this mental health is a big taboo. If you have hypertension, you have diabetes, or you have a heart problem, you go to the appropriate doctor and get the proper attention, and your family is also very supportive in that way to go to the physician and get it cleared. But when you have mental health issues, especially if you're depressed and you can't handle something because you're mentally weak, or you're just stressed out about the whole thing, that is kind of pushed under the carpet, and they just say it's okay, you'll be better, and they don't even want to discuss about it openly. So that's something that we need to change as a society, that if you are stressed, it's okay to talk about it, and it's okay to get actually professional help to overcome the stress is something I think all of us have to change, including the physicians, the caregivers, everything. Everybody has to understand that stress needs to be addressed properly, and little bit of counseling. It doesn't need to be a professional counselor or psychologist. Even the family or the caregivers, the friends, if they can sit down and talk to them and help them overcome that stressful situation, that would be great.
All right. So I think she gives us very clear markers, which anyone can self-assess that whether the levels of stress are appropriate or more than what it is required. And sleep markers, I think, is important thing, as she mentioned, and also that there should not be any taboo in seeking support or providing help as well. Now, specifically, ma'am, people who have diabetes now, they have to really have a very very disciplined life, and then there is something in their mind that I may have a lot of restrictions now in life, which may lead to stress. Those patients who may go on to insulins, and for they start avoiding going to social functions or events, just because before food they'll have to take insulins. So there are taboos which then eventually build into a level of stress. So what's your advice to the person who is having diabetes on this, and what's your advice to the stakeholders as well in the society on how to help that individual manage the situation?
See, first thing is like when you have diabetes, the first most important thing is your life becomes more disciplined. Like in the sense, your medications has to be taken at a particular time, and you also have to eat at a particular time. See, first most important thing that we stress when somebody is diagnosed with diabetes is that you get your exercise routine done, and then you take your pills on time, eat your food on time. So this itself by itself gives somebody a good a kind of a timetable to be followed, which kind of puts in more discipline in the life more than anything else. So if you prioritize your health, anything can be done. Even taking a shot, like an insulin shot, even in a public forum, should not be a taboo as long as you prioritize your health. There's nothing. It's not a drug or abusive thing that you're doing. You're basically you're involved in your well-being. So that shouldn't be a taboo. The patient should be first of all educated that having a high sugar like 300 and ending up because of complications of that particular, the sugar is not a 1 point thing, or it's not even a short term thing. We're talking about, almost if somebody is diagnosed with diabetes, say at 30 or 40, we're talking about another 40, 50 years of healthy living with diabetes. So at that point, if you prioritize and make this as your, your health should be your commitment, I think you can do everything, whether it's going to a party or going to a marriage hall or whatever it is. As long as you're taking your pills on time, and even if it has to be an insulin shot, you can still, there are a lot of insulin pen devices that's available. You can just go take it in a private area and come back. As long as you educate the patient and the caregivers about the importance and prioritizing your health, I think it should not really be a
Yeah, and very well said. I think you must prioritize your health. That is the utmost priority, and as long as you do that, I think the rest of the things would probably not worry you much or not stress you out. Okay, so we have the screen is currently blacked out. We'll just wait for a moment. But I think a very interesting point mentioned by Dr. Vijay Lakshmi here is one should not take undue levels of I think stress for taking insulins or for disciplining his or her life, because eventually if you discipline your life, not only it will help you manage the diabetes, but at the same time it may also help you manage your day to day work and routine as well. Can you hear me, Dr. Vijay Lakshmi? Okay, so we have a
yeah.
back. We just lost your connection for a moment. No worries, you are back. You can again put your device in the landscape mode. And that's what I was just sharing with the viewers, ma'am. How beautifully you have explained that if one prioritizes its own health, how it can be so helpful for that person, not only managing his or her diabetes, but also a lot of other works at hand. Let's talk for a moment the special situations. Now, if a child gets a type 1 diabetes, and we know that it can be a situation with at least 10 to 15% of diabetic population, that in the school going age, in their adolescence, they may get diabetes, which can be a very.
Extremely sorry about the connectivity problem.
No worries. So, the message to my viewers is, and also to you, Dr. Vijayalakshmi, there's no need to have stress on, these poor networks. This is something beyond our control. So, I'll take in the counseling, which she has just given to us in last 10 minutes. All right. This is a very simple problem to have. Maybe let's go back to other special situations, which may occur in diabetic population. I was just, I'm trying to learn from you. How do, we help uh, people with special populations, like, someone having type 1 diabetes in childhood or adolescence? That's a school going age. Parents get worried. Or, someone during pregnancy, a lot of women, they pick up diabetes during pregnancy, which even though is, periodic in nature. So, what is the role of family here? What is the role of, doctors here to counsel and support the patient? What is the importance actually of a psychosocial support here in this special population of type 1 diabetes and diabetes during pregnancy?
இந்த வைஃபை ஆன்ல தான் இருக்கு, but I need to connect you. Am I audible now?
Yes, you are audible. Could you hear my question earlier, or you want me
Yeah,
to
type
repeat
1.
it?
Yeah, no, type 1 population. You were talking about type 1
Type
population.
1, yeah. So I wanted to know about, type 1 population and, women who get diabetes during
Gestational
pregnancy.
diabetes
So
and type 1
what's
population.
the, yeah, so what's the role of family and, the other stakeholders in the society to
Extremely
provide the real
important.
psychosocial support?
These two population are very close to my heart because I work with my friends who are logicians. So, like a major chunk of my OPD is usually gestational diabetes and also type 1 because I work in VHS where we treat a lot of poor type 1 diabetic patients. So both these populations, are like vulnerable group where they need the support of the family, the extended family, especially when we talk about a gestational diabetic. Either there is an extreme problem of both the mother and the mother-in-law trying to overfeed the mother, getting into, as it is, our burden is overnutrition, trying to overfeed her and complicate the process, or they kind of put the blame that there is something wrong with this girl, that's why she's developed this gestational diabetes and all that. So here, I think both the husband and the caregivers at home have to be considerate to the fact that gestational diabetes is a metabolic challenge thrown in by the physiological state of pregnancy itself. There is a lot of physiological adaptation that happens to make sure that the baby is getting a constant supply of glucose. So that there is a lot of insulin resistance that happens during pregnancy. So that can cause unmask previous pre-existing type 2 diabetes also can be unmasked in during pregnancy. They have to understand that pregnancy by itself is an insulin resistant state. So they need to make sure that the patient gives adequate nutrition. Not, we don't overfeed them as well, but the baby and the mother should get adequate nutrition, because here when we're talking about gestational diabetes, we're talking about almost two generations. Not only for turning into a type 2 diabetic long term. Has the tendency to develop type 2 in
Yeah, you can carry on. Yes. Uh, I think no, we're not able to hear you actually. Okay, so I think we maybe in this world of technology, this certain still seems to be an issue, and I think our expert speaker, we have lost the connection with her, although she's trying her best to be back, but I think the experience for our viewers today may not be uh, seamless. So maybe what we will do is we will conclude today's session here, and we will try to once again invite her back on a later date and do this program again. So for all our viewers who joined us today, I'm thankful to them that they joined us for this live session, and and I think whatever bits and pieces you would have picked up in this conversation, they may just be, I'm sure that you can make use of it. So with this, I thank you and good night. And today we didn't had, I think, a good connection, but we'll join back on the same topic. We'll do it again for you guys. All right. Bye bye. Have a good time.